Okay, it is my pleasure to introduce to you Mary O'Dowd. Mary was serving as Deputy Commissioner of the department when she was nominated by Governor Chris Christie on March 25th, 2011, to serve as the state's health commissioner. She has wide-ranging experience in the healthcare field with a focus on management and finances. Before joining the department, Ms. O'Dowd managed revenue cycle operations for the emergency department at NYU Medical Center, where she developed quality assurance programs to achieve goals related to productivity and financial metrics. Additionally, she worked as a legislative aide for the New Jersey General Assembly on education and healthcare issues and as Assistant Vice President of Legislation and Policy with the New Jersey Hospital Association. Ms. O'Dowd is a graduate of Douglas College, Rutgers University, and holds a master's in public health from Columbia University Mailman School of Public Health. She has also completed a fellowship in hospital finance at NYU Medical Center. So I bring you Mary O'Dowd.
Good morning, everyone. Well, you're awake. That's great. It's Friday morning. You spent the night in Atlantic City, and you have some energy. That's good news. Thank you very much to the New Jersey and Delaware Valley HIMSS organization for inviting me here today. And I see many friendly faces in the audience. Bill O'Byrne is here, and Joe Carr. It's good to see that you guys are continuing to work together. Not only with the department, but with all of our partners that are here today. On behalf of the Department of Health and Governor Christie, welcome to Atlantic City. I hope you've had a good 24, 48 hours, and hope you got some sleep too. I wanted to introduce two members of my department that are here today, Kathleen Bennett and as well Colleen Woods. Kathy is the Director of Policy and Strategic Planning at the Department of Health, and Colleen is our Director for the Department's Health Information Technology Office. So just talking a little bit about where we are today, the CDC recently reported that 55% of physicians nationwide are now using electronic health records. And of them, 85% are happy about it, or at least somewhat satisfied with the technology. And we know that there's great variety in terms of that feedback. The New Jersey numbers are just a little bit behind, but not far behind those of the nation in terms of EHR adoption. And we are hoping that forums like today's will continue to not only grow New Jersey's involvement, but also help us to surpass those national numbers. Thank you all for all of your work here today and for the work that you're doing out in the field. While physicians and hospitals are implementing internal technology where they are based and where they're working, we know that many of you in particular are working to actually connect all of those systems so that healthcare providers have the patient data that they need at their fingertips no matter where they are. Health records or electronic health records and health IT in general gives healthcare providers the ability to view critical information, keep track of patients' medications and test results, fill the gaps in patients' health histories, and avoid unnecessary procedures and improve treatment outcome. While we've made tremendous strides this past year, too much information in our healthcare system is still on paper. As a result, information falls through the cracks between doctors and hospitals, hospitals and rehabilitation facilities, one specialist and another, or between even the day and night shift. A report released last month from the Institute of Medicine on the cost and complexity of our healthcare system stated that better use of data, and I would argue information, is critical and a very critical element to improving our healthcare system. They estimate that about 75 million Americans have more than one chronic condition, which requires coordination among multiple specialists, increasing the potential for miscommunication, drug interactions, and conflicting interventions. The IOM points to electronic health records as a tool to potentially improve the way data is captured and shared. Electronic health records can eliminate the needs to repeat tests, ensure that life-saving patient information is there and available at an emergency department when a patient is brought in, or when a patient is treated by a new provider or specialist. Health IT can make health care more efficient and improve quality and reduce medical errors, saving lives. Not to mention, it makes life for patients easier. It reduces paperwork, allows for scheduling appointments online, and eases communication between the provider and the patient. And I will say, as a patient in New Jersey, I have gone through the experience of my physician's office going from a paper-based system to an electronic system. And the ease of just not having to write that list of all the medications or my history over and over again and remember it. It really hit home for me when I went to see a new specialist and they said, well, are you still on this medication? I said, oh my goodness, I even forgot that I had that illness. Because for those of you who don't know, I had a baby 15 months ago, so I was seeing the doctor a lot, and I was forgetting a lot about it. And so even as a well-educated patient who understands a lot about the healthcare system, it was helping me. So for those individuals and those patients who have less resources necessarily to navigate the healthcare system, just think about what an impact that can make for them. Our state has made great strides, not just in my doctor's office, but in particular working with our state and our federal partners. We've made significant investments in building HIT in New Jersey. We've invested more than $11 million in our regional health information organizations and facilitated meaningful use for providers, helping them draw down an additional $182 million in incentive payments. New Jersey currently has 5 health information organizations in the state, and I know we have a lot of HIMSS and HENS and others in a variety of forms around the state as well. These health information organizations include more than 2,000 physicians, more than 50 hospitals, 8 federally qualified health centers, and other provider settings such as long-term care facilities. This year, Governor Christie reorganized government and gave me the gift of Health IT by providing the statewide leadership and coordination efforts for health information technology in the Department of Health. We are now working with our partners to support the use of health IT across the state, promote the adoption of electronic health records, and eventually create a statewide health information network. That network over time will integrate available healthcare data securely statewide so that key clinical information follows the patient no matter where they receive care. Health IT is also a critical component to improving healthcare quality and delivery, in particular with our efforts around regional and local health planning efforts. Sharing information is key to the success of our regional health planning, and some exciting work is being done here in Atlantic City within the provider system of the Atlantic Care Health System. And our regional health teams in the cities of Newark, Camden, and Trenton are sharing information and working together, which by itself is an achievement. Sharing data, managing patients, and with significant health needs, and specifically are seeing results in reducing emergency department use where it's inappropriate or unnecessary, and improving the quality of life for their patients. Sharing data about top diagnosis and hotspots allows for meaningful improvement in the quality of care delivered in our communities. By way of one example, in Camden, providers were able to identify a specific apartment complex as a hotspot for costly emergency department visits. Data showed that many of these residents lacked access to primary care and went to the emergency department for common health conditions such as colds, ear infections, and sore throats. With this information, they took the step of placing a nurse on site to help them manage their chronic health conditions, which resulted in reduced emergency department visits and improved those individuals' quality of life. There's been a lot of national attention shown to the efforts and the improvement of what the care delivery system in Camden is doing. And so New Jersey is really a star in many ways in terms of how we've been able to harness the use of information to improve care. And beyond the positive public health impact, health IT advancement is good for our state's economy. By growing this industry in our state, we can expect the creation of new jobs for our residents. According to the U.S. Department of Labor, health information technology is one of the 20 fastest growing occupations in the United States. And they project employment growth in this area will increase by 21% between the years of 2010 and 2020. And for those of you watching national politics, clearly this is an issue that everyone is interested in. To help fill this growing field, 8 of New Jersey's community colleges are focused on HIT workforce development. They have trained students to take advantage of the increased opportunities, employment in and within health IT professions. Health information technology will have a great impact on our state, not only from an economic standpoint, but from a quality of life standpoint, and to the overall population health for our residents. I want to congratulate each and every one of you for participating in today's event and yesterday's as well, and on the progress that you're making out there in the trenches. In my introduction, you mentioned that I had been at NYU Medical Center, and while I was there, we implemented a patient tracking system. And so I know a little bit, just a little bit, about what it means to really try to move from a system that is based on people talking to each other and paperwork being handed one person to the other, and sort of the trauma of what it means to go to an electronic system for all the different practitioners, not just the doctors that get a lot of the attention, but the clerks, the registrars, the nurses, and the administrators. And it really is a tremendous effort, but after a little while, it's amazing how much people forget how to even use that paper system and the power that it really provides them to not only communicating better with each other, but also treating their patients better. I've seen it firsthand, and so I know what work goes into it, and I really just want to thank you for all the efforts that you're making on bringing us to that next level. So thank you very much, and I hope you enjoy the rest of your day.